talk a little bit about who you are and what you do. And we'll just start with you and then roll down the line.
Okay. Is my mic on?
Oh, you're on. You're good.
I'm Vendella Collins, and I am the Executive Director of the Michigan Developmental Disabilities Council. We are an advocacy organization housed within the Department of Health and Human Services. And our advocacy, we're federally funded, and our federal mission is to advocate with and for people with developmental disabilities. We help systems to change, so that systems change is one of our mandates, and then build capacity in the communities for communities to be more receptive and responsive to the needs of people with developmental disabilities specifically, but people with disabilities in general. And our hope is that our work is going to help people with disabilities to be more connected with their communities and to have their lives to be what they want them to be. So I just want to just quickly say that, so we talk about people with disabilities, we seem to talk about them in segments and systems and how systems react to them. But my challenge to all of us is to understand and recognize that people with disabilities want a full life. They want the same kind of life that we have. And so our lives are not segmented around systems. Our lives are segmented around the things that we want and desire. So I've challenged us to think about people with disabilities in that same manner.
My name is Shawnice Laurie Johnson. I am a vocational rehabilitation counselor with the Bureau of Services for Blind Persons. We were formerly the Michigan Commission for the Blind. My primary goal on my job is to assist individuals who are blind and visually impaired to obtain employment, to help them to maximize their independence, and to help them to realize that they can have a full life even though they are a person with a disability. Our agency services, we're a state agency, as I said, but we service all of Michigan. We have 7 offices statewide, and so we're broken up based on where our clients live. So happy to be here today.
And I'm Lita Momeni. I am a policy specialist at the Michigan Department of Health and Human Services, specifically in the Medical Services Administration. I oversee a number of Medicaid services, one of them being non-emergency medical transportation. And it's been quite a learning curve for me. I've recently started the position the last couple months, so I've enjoyed it so far.
I'm Rachel Telder. I work for the Michigan Department of Health and Human Services as well. I'm specifically in the Aging and Adult Services Agency. So we recently merged. We were in a different area, but I'm within that. I work for the Adult Services Policy area. So we serve 3 programs: Adult Protective Services, Adult Community Placement, and Independent Living Services. And then under the aging part of our agency, or our department, we work a lot with the AAAs, the 16 AAAs in the state of Michigan. A lot of field workers who go out and connect with the AAAs, see what they're doing. We have prevent grants as well, where we monitor and manage monies that are going out to the state of Michigan, to agencies and groups who are working to basically better the lives of older adults and people with disabilities, and make them be able to continue to live with dignity and age well.
I'm Suzanne Thielen, and I'm the Director of Strategic Communications and Customer Service for the Michigan Veterans Affairs Agency. We are a 5-year-old agency with an entrepreneurial spirit, and one of the things that we do is to service veterans and attract them to come here to Michigan to work, but also for those who already live here, to make it possible for them to live and retire and to have the best quality of life. Specifically, some of the things that we do in Michigan that make us a little bit unique is that when we work with the VA system, we're actually split between what are called 2 VISNs, which are 2 regional groups that are identified by the VA. The Lower Peninsula is in VISN 10, and the Upper Peninsula is in VISN 12. And many of our challenges that we have in both of those VISNs is the length and the space that, and the amount of time it takes for veterans to get to their transportation, using transportation to get to their appointments. So one of the things I'd like to discuss with you and to invite you to look at is how you can help us to bridge the challenges that we have of getting veterans to their appointments that may not only take them hours to get to, but also may take them out of state. So in the Upper Peninsula, they may go to Milwaukee for surgical procedures. In the Lower Peninsula, they may go to Indiana for healthcare and for other types of mental health and for other types of procedures. So looking at those challenges of not only how do we get people to the community-based outpatient clinics, which are maybe closer by in a community, but how to get people to the very few VA hospitals that we have in the state and the additional services that veterans are needing but are not necessarily provided in the state is a unique challenge that we have in the veterans community. And we look forward to working with you to partner and to find solutions to those challenges that can get veterans to their appointments every time they have an appointment, so they can complete their treatment programs, as well as to stay in Michigan and not leave the state to go to other places where the transportation is less of a challenge.
Hello, I am Annie Uraski. I'm the director of the Division on Deaf, Blind, and Hard of Hearing within the Michigan Department of Civil Rights. And we are the only state agency that really focuses on services and needs for the deaf, blind, and hard of hearing community in Michigan. And we are often overlooked as a community. We are the oldest state agency in the US that focuses on the deaf, blind, and hard of hearing community. And really, we are here to advocate and push for more understanding and successful communication and rights for our community. We strongly believe that people who are deaf, blind, and hard of hearing should have equal access to all services that are provided by the state. And we would like to focus on a lot of collaboration efforts within other state agencies and organizations, communities, and the community themselves, and to bridge that gap and increase awareness of the deaf, blind, hard of hearing community. We are a small population. But every individual needs are diverse and should be met regardless. And hearing loss starts from birth to senior citizen and can have impacts at different times in people's lives and impact their needs. So the biggest part of my job is to continue that education, to be out in the community, become more visible and raise awareness of our community. Related with transportation issues, we do have concerns about the needs because a lot of people with disabilities the unemployment rate is high for people with disabilities because they're not always successful in being able to find transportation to and from their jobs. So that's a big concern of ours.
Well, I just want to start by saying thank you. You guys do really hard but important work. So thank you for everything that you do. My first question is a big one, but a relatively simple one. What do you see as the greatest barrier to being mobile in your community, the state, and in general? And I guess I'll just let whoever has the first thought start, and then we can kind of take it from there. Yep, please.
Sure. This is Annie speaking. I'm sure all the panelists here hopefully will agree with me on this, that the biggest barrier is that people don't understand that people with disabilities live in a world that is not designed for them. It's designed for able-bodied people. You know, I'm a perfect example. Like new software systems and technology, many of them are based on sound or voice activated. And so we are expected to accommodate to live in a world that's continually changing. And so the people who are responsible for making those changes don't understand our needs as members of the disabled population.
So another issue that we hear about is that transit agencies are really not working together to help individuals to access their full community. And what I'm talking about is crossing county lines, as we heard some of the transit agencies talk about earlier this morning. People's lives don't just stop at a county line. Some individuals can't visit their families because they can't get across the county line. So that's been a tremendous issue for folks, and so we hear about that. We also hear about the fact that transportation is not available at the times when people really need them. You know, we're talking about individuals with disabilities who have lives other than just going to the doctor or going to work. I mean, they want to go shopping, they want to have recreational activities, they want to access family and friends. And so this doesn't typically happen all between 8 and 5. So people want access, transportation access in hours other than that's typically provided for them. And then one incident that people have talked to me about, and it seems pretty minor, I've heard people with disabilities talk about physical access to bus stops. I mean, and we have snow in this state, and people can't. The bus stops are not shoveled sometimes, so people can't actually physically access a bus stop, and so it's pretty dangerous for people to be waiting in wheelchairs in the street. So that seems pretty simple, and you think, okay, well, somebody should be shoveling those bus stops out, but it doesn't happen on a regular basis, and so people have talked about that. Another issue that I've heard people talk about is the length of time that they're on buses in terms of lack of coordination between even operators. We have a regular meeting here, we have a meeting in Lansing for folks with disabilities, and so they need to call and make arrangements to go to the hotel which we're having this meeting at, and so 4 or 5 buses come. And then the drivers won't put people on the same bus. They say, no, you can't get on this bus because I wasn't sent for you. So it's a lack of coordination, and I think it's sometimes construed as just misuse of funds, basically, because we shouldn't be sending 4 or 5 buses when 1 bus will do. So it's just having operators to even coordinate for individual systems, and that's just one system that I'm talking about, but that doesn't mean that it just happens in that one area. I don't know for a fact, but so people are talking about just coordinating that so they can get to where they need to be in a timely fashion. If people are going, if 5 different people are going on a bus and they're going to 5 different areas of the state, then it takes people longer to get to where they need to be. And so they're just really hoping that there can be some better coordination between the systems so people can get to where they need to be expeditiously. So there's just a few of the issues that I've heard about.
I think there's several issues, but I think overall, the lack of transportation is taking away individuals' choices, and it is handcuffing individuals to certain areas or certain things. In addition to servicing individuals who are blind, I am also blind, so I live it on a daily basis. And so it takes away a person's right to choose where they'll live, the ability to get to and from a job. I start my job at 8:30 a.m., but in order for me to get there on time, because getting to work on time is extremely important to me, I have to leave home about 6:30 in the morning to get there. So it takes away a lot of choices, and I live less than 10 miles from my job. So there's lots of issues. I agree with also when you talk about people with disabilities, most topics that they think about is work and doctor. You know, I have 2 minor children. What about getting back and forth to all the extracurricular activities that children have? Being able to go to the grocery store, being able to go to a movie. It's just lots of things. Individuals who are sighted have choices. You can decide to drive, you can carpool, you can take a bus, and people with disabilities should also have choices.
Yeah, and so with my perspective, I work in NEMT for individuals who have Medicaid. So the beneficiaries that we have in our population are most chronically ill. They may have more conditions than others. So that's something that you have to consider when you're thinking, well, why can't they get to their medical appointment? So the places that our beneficiaries need to go are often doctor's appointments. Maybe they need to go to the dentist. And one of the barriers that we have, especially in the rural areas of Michigan, is that we predominantly rely on volunteer drivers. And our volunteer drivers are great, but some of them are themselves Medicaid recipients, or they're aging. A lot of our drivers are older, and they do it because they want something to do and help out, and they've already retired from their career. So we don't have enough providers in the rural areas that are transportation vendors. So our options are slim. We don't have as many individuals available to drive our beneficiaries. Another issue that we have is, I'm trying to think of what it was now. I'm blanking on it. is that we have fewer on-demand transportation options. So a lot of times, you know, I just want to take a poll. How many of you booked an appointment with your doctor or dentist in less than 48 hours? Has anyone done that? A lot of beneficiaries don't have that option to book something last minute, and they have to have advance notice to do it. And we all know that something comes up, you might have to cancel that appointment, and you have to switch it around. And it's hard to try to be relying on someone else to get you to the places that you need to go, and you kind of take that for granted when you have the option of driving your own car. So those are some big issues that we see with individuals who have Medicaid.
Can I add to that
You have
somewhat?
the closing thought.
Okay.
of this question.
I would say when I think about seniors and people with disabilities and issues of transportation, from my perspective in the field, really a lot of it is cost and comfort for them. We say, you know, gosh, there's all these options out there. They can take the bus, they can do this. But many seniors or people with disabilities don't feel comfortable traveling alone. They don't feel safe. If anyone's familiar, at least I am, with the CATA station in Lansing, it isn't a very safe or pleasant place, and I would not feel comfortable with my grandmother there on her own. So many of the people we work with aren't comfortable traveling alone, and most of the programs that might subsidize their transportation don't allow for someone to ride with them or a caregiver or something like that. So are they then paying an extra fare for someone else to feel comfortable, or are they just not going at all? And yeah, in general, it's many of the transportation options are cost prohibitive. I know Spectran in Lansing, which is point to point, the small buses, it's $250 each way. And the state will subsidize or pay for medical transportation, but again, going to the grocery store, doing things that everyone wants to do to get out of the house and go places and be social and be part of the community. Can you really afford that $5 round trip for every time you want to go do something and leave your home?
I would just add, sorry, I
yeah,
would want to
please.
add one additional thing, which is for our folks, we have liability issues with regard to those people who are volunteers and others. We have equipment that goes unused in the Upper Peninsula, DAV buses, Disabled American Veterans buses. We have 110 volunteers who ride those buses, but we have a hard time recruiting because of liability concerns. And so looking at the partnership opportunities to be able to sustain those volunteer networks and to get those buses in action and to use the VA grants that we leave on the table because we don't have enough riders to be able to get to their appointments and use the vouchers that are available. These are the types of challenges that veterans have. And we're kind of in a great position because we're a trifecta. It's a trifecta population. We are seniors. 73% of all of our veterans are age 55 plus. We are people with disabilities, and we are also veterans. So anything you do in the urban areas, we're looking to partner with as well. But certainly when we look at the rural areas, these are unique challenges, and money is on the table, the volunteers are there, the equipment is there, and it's underutilized, and we need partners.
Thank you. So we have a lot of questions coming in. So I'm going to do my best to keep asking them, and then maybe we have one or two people answer each. And if there's a third that wants to deliver a final point, that's fine too. So talk a bit about how you communicate out to the larger population that may not understand some of the barriers, may not understand the day-to-day. Talk to me about the messaging and talk to me about the action around that communication.
So for us at the Developmental Disabilities Council, though we have just 10 staff that are employees, we have worked with a lot of individuals in the community of people with disabilities and other allies, other advocates, and people from other agencies that actually work with individuals with disabilities. And so we have individuals with disabilities to tell their stories across the state. We help individuals to be connected with their local transit agencies. We encourage individuals to go to their city councils, to any organization that's in their particular locale that they really want to have, that impacts their lives, just so that they can hear a firsthand story about what that particular service means to them. And we found that as we work with individuals to tell their own stories, we also have opportunities for individuals to talk to the policymakers, to talk to their legislators on a pretty regular basis so that people understand that what the challenges are for people with disabilities in this state and how those challenges affect their ability to actually enjoy their life and have the life that they want and be connected with their community. One of the things that as we talk about these challenges, we talk about them in a more global perspective that says my community really is no longer my street, my block, my city, my county. My community is greater than that because I want access to everything that other individuals without disabilities have. So we put that message out with individuals with disabilities themselves so they can tell their own stories.
We have a program that's 24 hours, 365 days a year, 7 days a week. It's called 1-800-MISH-VET. It's a program that our veterans and their family members can call if they're facing any type of if they have questions or if they're facing an emergency. 85% of those calls that we get, which average about 1,700 a month, 85% of those calls are actually calls for DHHS assistance. Almost every single call we have is someone who has a transportation challenge in trying to get to their job, to an appointment, or to others. So we have an ability we publicize that through advertising. You can self-service through our website, or you can full service through our 800 number every day of the week in conjunction with Michigan 211. The opportunity is to look for those matches and to bring people into the service that already exist through the transit authorities, look at private volunteers or organizations like veteran service organizations that might be able to provide a one-off type of a solution. But again, being able to advertise to all the veterans across Michigan and to connect them around the clock with information and to transit solutions are the way that the veterans, how we service the veterans in our community.
All right, so the next question, I'm going to allow a couple of you to pick your own adventure. So talk to me about some of the biggest challenges, design challenges around 1, vehicles, cars, 2, bus stops, and 3, transit services. So when you think about those 3 elements, what are some tangible changes you'd like to see? And you can take a second if you'd like.
This is Annie speaking. One thing that I think is really important is that the design needs must be accessible. Accessibility is paramount. The technology is changing how we communicate every day. But as I said earlier, like texting was developed for deaf people, and that's true. However, there's still some people in the deaf, blind, hard of hearing community who don't have the ability to text. They don't have mobile phones. They don't have those devices, especially in rural areas. They don't have access to the technology. So this is still not necessarily a means to get independent services. So it's a big barrier. So I think the design elements, being more inclusive of other methods to access the services is really important, as well as the opportunity for more collaboration, more awareness about the needs of our specific communities, because hearing loss is the 3rd largest disability in the United States. So that it's the kind of disability that can be invisible. Walking down the street, you're not going to know that somebody has a hearing loss. So myself, as a deaf person, I'm independent enough to know how to navigate my world. But many people are not in the same position as I am. Specifically, deaf-blind people suffer or experience a lot more isolation. And so with the design aspects that we're talking about today, they're generally not considering that population. One perfect example would be like automated vehicles. The software is often designed with sound. So people in my community don't have access to those types of services.
So even talking about access issues, even around autonomous vehicles, the laws have to actually keep up with what this whole process is going through, because when we talk about that, not only physical access to a vehicle, you're talking about whether or not a person actually needs a driver's license. So if it's driverless, does a person with a disability actually have to have a driver's license to operate an autonomous driving vehicle? So So access comes on a variety of levels. The challenge, I think, is for us to involve more people with disabilities as we are designing, just going through the design process. Because most of us probably won't even think about the things that people will encounter on a daily basis trying to use this technology. So it's important for us to remember that as we're working on things for people with disability, to involve them in the whole process so that we are actually getting it right the first time. Other issues, I talked about the physical access of a bus stop. It's also the buses have limited access for mobility devices, and I'm not suggesting that. In fact, I don't know how to make sure that individuals who have mobility devices don't have to wait long periods for the next bus that's accessible. So we need to figure out a way to have all buses to be accessible on some basis, so that people are not feeling like my disability is less than another disability, because people who don't necessarily have to have a tie down, they can get on other buses and I have to keep waiting. So that whole access issue around time for people to get where they need to be, I think is important for us to pay attention to as well.
I think design is extremely important, and with regards to even the way that a bus is designed, we have individuals who are blind who also have other disabilities. Maybe they're in a wheelchair. So some of them are at a bus stop, and because that bus doesn't have what they need, they have to wait until maybe the next one comes and hope that that one has what they need. Also, a person who is blind, most of the clients that I serve have had vision in life and lost their vision due to various reasons. And maybe when they had vision, they knew where the bus stop was at. And so when you lose your vision, how do you know that you're at the bus stop? How do you know you're at the right spot? And if you're not there, sometimes a bus driver won't stop and say, are you waiting for the bus? They'll just assume that you're not taking that bus. So I think design is extremely important with persons with disabilities. I think it's important to get individuals involved with disabilities from the very beginning, because it's easier that way than to go back after the system is designed and in place, and then to think about how now do we include these individuals, or how we can incorporate them. It's a lot better to do it from the very beginning.
Okay, I got time for one more, but I also have other questions. So going once, going twice. All right, next question. So this is specific to a particular group that I don't know that we've spent a lot of time on so far, and that's veterans. You know, a disabled veteran can be easy to spot. You know, maybe it's a lost limb to an IED or a battle wound of some sort. But in your prep documents, you see the last passages on invisible disabilities and how PTSD can play a role. And so this is specific around veterans. I have a couple questions about the percentages of veterans that have unmet transportation needs. And there are some in the crowd, too, that have tried to connect in meaningful ways, but have run into institutional barriers. So I know I threw a lot at you, but I'm hoping you could comment on a couple of those thoughts.
Sure. So I would say that it's probably been difficult to reach and find one place to have the veteran conversation. Throughout the state of Michigan, we have 10 veteran community action teams that are in each of the prosperity regions. And so sometimes people have approached those on a local basis in order to start that conversation. Sometimes they've started the conversation with the VA, and we hope that you'll start that conversation with the state of Michigan. One of the nice things that we're able to do in our short time as an agency, we've been able to be that central coordinating point, to bring all those agencies together so you can bring one point of contact, one single door through which you can have this conversation, and we can connect with each of those supporting organizations as is necessary to find the solutions that we need. So if I look at the number of, I mentioned before about the amount of veterans that are over the age of 55, 73%. If you look at the tip of the mitt, which is essentially prosperity regions 1, 2, and 3, so kind of clear and above. That is 27% of all Michigan veterans that are living in that area, 27% of the entire 608,000 person population in the veterans community. That community is particularly older and needing additional services. So looking to connect to their either their jobs, which we've talked a little bit about. We focus mostly on health because we have so much left on the table in terms of VA support money that we're not able to use, and transportation equipment that we're not able to use, and volunteers that we're not able to put into place. But we also look at the needs to get veterans to jobs, to get them to their VA appointments, which are for their benefits. So one of the things that we do in addition to, through the VA, in addition to connecting them to medical services, is to connect them to pension and compensation types of services that puts money into their pockets. It helps them to become more independent and live a better life. Many veterans are not able to get to their VA service officer or to their service officer to have this claim conversation, or to follow up with other types of conversations they need to have to get the supportive services. It takes about 180 days to get a VA, to get your claims through the VA. In the interim, you may still have financial challenges as a veteran, and so you need to take advantage of Health and Human Services programs and other types of things. So we look at the veteran community as those who are most able and are able to have their own transportation, who are connected to jobs, those who are struggling in the transition, who need to have some assistance but have some of those supports in place, but just need some additional steps up, and those who are disconnected and disaffected and unable to access some of those services and are isolated from their community and from their health needs. So if that, to kind of start that conversation on that, I certainly will continue that throughout the day.
Mm-hmm. So I have a question coming in from the 618, and I like it because I've heard multiple answers end up with essentially, hey, resources are mismatched. There's not enough drivers. There's multiple vehicles coming to the same pickup. So I like this question because it asks you kind of poignantly, is that needed? And as people think about the RFP for these solutions, is matchmaking something that would be of great use? So I'll read the question, but that's essentially the context around it. The coordination problem, such as multiple vehicles showing up to pick up single disabled individuals, is a waste. Also, the vehicles not being used, and then lack of drivers. Does it seem like the right partner is a company that can help identify the mismatched resources and allocate them appropriately? So basically saying the same thing, but in two different ways. So feel free to fire away.
So I would say definitely, yeah. There are many opportunities that we could reduce costs by having ride sharing. We've heard of situations where one person is in the vehicle and it does take coordinating, but it's doable. You can have someone coordinate pickups, and if you know they're being dropped off in the same area, you can coordinate that pretty well, and it works out better for everyone, really. I think another thing to consider is, and I'm not sure if it kind of ties into this or not, but having freedom of choice as well, having the ability to choose what kind of transportation you want to have, having someone that can coordinate that and make sure the person's wishes are being somewhat, coordinated. Maybe I have a preference in having my transportation come later in the day because early in the day I do a volunteer activity. I know that's not common for us to think about there being choice in transportation, but there really should be, and there's many opportunity where we could try to help beneficiaries and just non-beneficiaries, anyone in the community, get what they want.
So I think that the coordination of opportunities to get where you need to be as most expeditiously as possible, I think it's just a common courtesy that people with disabilities expect, because none of us would want to spend our time a whole day getting to one place and we only need to be there an hour, and then having to wait hours to go back. So I think that if we're trying to be customers focused and customer friendly, if you will, and be responsive to the needs of people, I think those kinds of just things should just be automatically considered so that people will see themselves as a customer that you actually care about. I think that the frustration the frustration of folks with disabilities is there when they realize that I have to take a whole day to do this, where you could take to get this done in just a matter of hours. So I think just the customer service aspect of it is important, so that people can feel like they're a valued customer.
I would say, even to expand on what was said before, one of the things that we have is challenges in the veterans community. So think of if you're in Traverse City, as we talked about before, and you have to go to Saginaw to the VA. If you're in Sault Ste. Marie and you have to go to Iron Mountain. What often has is, even if you ride share together, sometimes your appointments go late. The bus leaves without you. The bus just leaves. You're stuck in Iron Mountain, right? So, and that's not a bad thing for those of you who haven't been to Iron Mountain. However, it is not the preferred way that people want to do this. They have lives, they have families to get back to, and without that ability for us to have that flexibility, either the on-demand or that supportive service that can back up when the bus leaves and somebody's got a late appointment, those are the types of challenges that we have in being able to make sure that people go to their appointments, continue to go to their appointments until their treatment is finished. They can schedule a very short window appointment. So maybe they need a 48-hour appointment or 24 hours, and they didn't schedule the van this week. They still have to get there, and so how do we support those and find those breaks? And that happens in the urban communities for sure, but it is particularly challenging when you get to the rural communities, because the distance alone means that ride sharing means that if your appointment's at 10 and your appointment's at 2, you're all in the same bus, and you don't get back until 9 o'clock at night. And you left at 5 in the morning.
Yeah, coordination of services should be the standard. In addition to sending one bus for one person, most often you are picked up and then you are taken to a whole nother city for them to pick up someone else, when getting you to where you need to go may be 10 or 15 minutes away. So me having to leave home at 6:30 in the morning is not because I just enjoy the ride, it's because most often other individuals have to be picked up in other cities, Hamtramck. So I'm riding from Detroit to Hamtramck, or from Detroit to whatever other city while they're picking up someone else. And if I don't do that, I won't get to work on time. So coordination of services should be a standard.
I want to hit on a couple of the invisible disabilities that we haven't really talked about. And selfishly, I'm asking this particular question because I've had multiple people in my family diagnosed, and I've seen it end lives maybe sooner than they should have ended because a caretaker in my family was taking care of his or her spouse, and it was just too much to handle. So I'm going to list off a couple invisible disabilities, starting with the one that's most personal to me. And if any of you just have any thoughts on solutions to help with mobility around these solutions. Dementia, diabetes, hearing loss, autism.
I kind of spoke of this earlier. I think with some of those invisible disabilities, or just disabilities where being out on your own can be very challenging, I think we do need to offer some way to encourage the ability to have a caretaker or a ride share, someone with you, a support person. And that should not pose an extra financial barrier when you need to go somewhere. It should just be an automatic standard so that you're comfortable in your community. You've got that support person with you. And I think many people with those disabilities might face undue anxiety, or being in public situations or certain situations might be very unnerving, especially things like dementia. When you start not knowing where you are because you remember old routes, but what if the bus is going a different way? That can be extremely anxiety provoking. My mom has dementia, and I had that experience happen to me. I went home to visit her, and we were gonna go to the zoo, and she was very comfortable riding back roads, and that's what she remembered, and that's what was familiar. That's where my dad always took her. Well, I'm like, I'm gonna go on the interstate, it's faster. So I got in the car with my mom and my kids to shoot to the zoo on the interstate, and she was extremely anxious the entire way there. It was very uncomfortable and unpleasant for her when it was supposed to be an enjoyable experience. So on the way home, we took the back roads, and it was actually a wonderful experience because she was remembering all the memories when I was a child and driving places, and we talked about it. So even things, just being aware that changes in routes could just really throw someone off, and knowing, I think working in a support system so that if someone wants someone to be with them that makes them feel comfortable or safe, that that's not going to be a financial barrier or extra cost. It should just be kind of the standard.
So dealing with,
Actually,
This is Annie speaking. One thing also that I think is important specifically for people with hearing loss, of course, there's a spectrum, right? Some people are very comfortable with their disability, and some are not. They're not ready to admit they're still going through the grieving process. So I think some things that we're missing is, or one reason that we're all here is we want to ask these tough questions, but we also want to offer solutions. We need to be able to have more discussions on how we can collaborate, how we can bring more awareness about the people and their disabilities that aren't often addressed. So that's why we're here today as well. So for people with hearing loss, everybody wants to be independent, right? We all want to be able to go where we want to go and do what we need to do. And I think related to providers or people who are responsible for providing services are not aware enough of our needs. So I think we need to find a way to kind of bridge that gap and approach it in a way where it's not causing a negative experience. Because often people with hearing loss, they don't want to rely on somebody else to provide services. They may be more comfortable, they may need help, specifically deaf-blind as well. They may need that caretaker. But how can we meet the needs of people on that range and that spectrum who aren't aware of the services or aren't getting the resources that they need? And it always starts with asking the tough questions. But at the same time, we're here to help provide those solutions.
that's good. So guys, we got about 15 minutes left. And I think that's a great transition. Your answer is a great transition into what I want to talk about next. We've talked a lot about the challenges and perspectives. Now I want to talk about solutions. We've talked a lot about the present, and we've talked a lot about the future, but not a lot about the past when it comes to actual success stories and metrics, things you track. So I'm looking out at the companies right now and the other organizations that are going to be part of this process, and they're thinking, gosh, what are some case studies in the past that I could build a business model around, make it better than before? And then what are those metrics to track success? So I'll open it up from there, but I'd like to spend the remainder of the time in that area. So solutions, metrics.
so at my office, the Developmental Disabilities Council, we have partnered with MDOT to offer a universal reduced fare card. And that universal reduced fare card is really, we started this because it seems that every transit agency had a different application for that process. And so we had a team of folks who worked together to develop a more universal application. And so and that was offered to transit agencies across the state. And so right now, it's my understanding that about a third of the transit agencies are involved in that. What I'd like to see as a solution is more transit agencies to become involved with that so that people with disabilities don't bear the onerous process, if you will, of having to go to each transit agency to fill out an application for this universal reduced fare card, because most agencies offer people with disabilities reduced fare. And by this, I mean that if I live in Wayne County and I have an application at Metro Lift, I think that's what we would use. And so if I want to go into, let's just say Ingham County, I need to get there, and there are counties that I need to cross to get there, I have to fill out an application for each one of those agencies to pick me up, to give me a reduced fare to go through that county. And so I think that if we can help individuals to feel like I'm really a part of this entire state, and this is where I live, the state, and I can access without having to fill out applications for everything every time I'm crossing a county line, I think that would help people to feel more valued and to ease some of the burdens, if you will, that people face as they need to cross county lines. So one solution is that more transit agencies get involved with that process that we've just employed, I guess, for the last, 4 or 5 months. So it's fairly new, so if you want more information about that, I'm sure we'd be happy to give that information, but that's one solution I think that people could take advantage of. Another is to really involve people with disabilities in your locales and not just treat folks with disabilities as a token part of a group. I mean, really listen to what people are saying about their needs, because I mean, I'm a firm believer that as professionals, sometimes we think that we know more about what people need than they know themselves. And so really listening to people and trying to incorporate what folks are saying about what their needs are, because we might think that transit is needed in this area of my county and people really don't even want to go there. So just listening to folks and having their voice be a paramount part of what you are doing to provide a solution. Because ultimately, if they don't ride the services, they don't take advantage of the services, it doesn't really matter. I mean, they're not going anyplace. So just using folks as disabilities as the experts on what their needs are.
So I'm getting a couple texts about the idea of just what's worked in the past, and I just like the way that 616 phrases it. Does anyone know of a whiz-bang solution that's an operation out there that can really do the job, that some of these companies and some of these partners can look at and say, wow, we could incorporate some things? Oh, that's telling.
This is Annie speaking. One thing that we're doing right now, my department is looking at. So in the state of Michigan, we've done a needs assessment on the deaf, blind, hard of hearing community, and the last time that was done was in 1989. So if you think about what we're trying to figure out, how many deaf, blind, and hard of hearing people are in the state, the Upper Peninsula, rural areas, urban, so many things have changed, obviously, since then. And so we are doing a needs assessment now. And because we cannot continue to add services and programs if we don't know what the needs are. So we need the data behind that to figure that out. So at the end of this year, November, December-ish, we're hoping to have the results ready from that assessment. And then we're going to use that to guide us, whether it be for 1 year, 5 year, or 10-year plan, but based on that information. So we're working on it.
One thing that DHHS has done that I think is really great, they're piloted and I think will soon go into full production across the state. What they call an enterprise service bus is what I refer to it as. And essentially what that does is allow us to identify, drop a pin based on where a citizen lives and find the services in their area, and to connect transportation resources into that. So what I'd like to see in terms of solutioning is how could we aggregate all those different transportation solutions, whether they're privately delivered, publicly delivered, voluntarily delivered, and put those into that enterprise data bus so that we have a robust database of where those transportation options are based on the needs of what we have, on the individual citizen and their specific needs, as well as the aggregation of maybe we can do ride sharing and other types of things. I think that's a great piece of technology that can be leveraged across all of state government and can also incorporate potentially the public and private partners. I know that we'll be incorporating that into our 24-hour service that we do, because we deliver with 2-on-1 in the evenings, nights, and weekends. And so that's an extension of DHHS. And so we'll have that available not only through our call center, but also I believe that DHHS and eventually we will want to make that available through our website as well, so that citizens can not only self-service through the website, but full service through the call center.
And so from my perspective, there is no solution that I could possibly say has been a good fit because there's not enough data. For us, you know, other than the 3 counties in the Detroit metro that we have a transportation vendor for, all the other counties in Michigan are through the local DHHS offices. They are caseworkers that are helping, or community resource coordinators that are helping beneficiaries, you know, find transportation, arrange their transportation for them. And there's not enough data for us to say what has been working in some areas versus other areas. But I can tell you some of the big problems that we do have, just to consider again, we don't have enough transportation providers to provide. We also have, you know, caseworkers are overworked. They have a lot of responsibilities when it comes to beneficiaries in Michigan. And so transportation may not be the the top item that they're getting to. Maybe it's just giving them benefits like food assistance. So trying to make sure that there's enough resources available to link individuals to services and making sure that they're aware of what options are available to them. I think that's a big key to make sure that we're connecting the services to the individual. And I think the other issue, gosh, I could probably go on a little bit because it's just an EMT is just such a difficult thing for not just Michigan but other states to tackle, and it's been an ongoing issue that we're trying to look at what other states are doing, what's been working, what some experimental programs that they're trying out that we could try out, but also making sure that we're following policies because we are limited in what we can do and where we can use our money.
And that's why we have analytics platforms in the crowd today. That's a really telling answer, all of it. So talk to me about, in our closing minutes together, how you're measured. Maybe it's, what's in your performance review. Maybe it's quantitative, maybe it's qualitative, because I think a lot of the people that are thinking about how to respond to this RFP are going to want to know how you're measured, because that ultimately is going to flow back to the customer and make a difference. So really quickly, if we could go down the row, talk to me about the top 2 things you're measured on as an employee of your organization.
So we're measured, the federal government actually provides us with our outcome measures. And so federally, how many systems are responsive to folks with disabilities? We have surveys that individuals complete to tell us whether or not they're satisfied with services, and so the federal government looks at that as outcome measures, and so that's one of our measurements. And then also we do have forums, community forum conversations with folks that said that when we ask the questions of really how they're living their lives and whether or not these systems are responsive to them, and they give us that anecdotal data of whether or not they're satisfied with the lives that they live.
So I, as a counselor, I am tasked with assisting individuals on my caseload with finding employment. If they're already employed, we help them to maintain the employment, and it's so many every year that I'm responsible to do that for. So transportation is extremely important because I can have individuals on my caseload that has very extensive employment history, where they qualify for lots of jobs, but the difficulty comes in how do we get them to and from that job. Also, once the person is on that job for 90 days and there's no issues, we close the case to successful employment. But we're also measured on if that individual is still on that job the second quarter or the fourth quarter after we have closed that case. If not, that is an unsuccessful outcome for the agency. As a counselor, I do have some leeway where I can provide transportation for a person to get to an interview. I can provide transportation for them to get to and from the job for a 4 weeks, 6 weeks. But then after my services fade out, I want to know that that person has a way that they can get back and forth. So that's what we do a lot of times when they're first on the job, is helping them find other resources so that once I back out my transportation services, are they still able to get to and from that job? And sometimes we have a person who's highly qualified, but they live in an area where there is no transportation at all. So I can assist them, but then after I'm done, they would lose the job.
And Trevor, I'm just going to make sure that I understand. The question is, what kind of qualitative or quantitative information do we use?
Quantitative, yeah. What
to
are you
assess the
measured on as a
success
state
of-
employee?
So again, there's really not enough information. I wouldn't be able to tell if beneficiaries are utilizing services through the Medicaid benefit or if they're utilizing it through an informal support. We don't know if it's helping them get to medical appointments or not because we're not really assessing that. We're not looking to see, maybe the person hasn't had an appointment in the last 2 years because they've been feeling fine and healthy. So we don't know if there's a barrier for them in getting to an appointment or they just haven't had any need to. And I think we do have data with our transportation vendor in the Detroit metro area where we do look to see, are the transportation providers coming in on time? Are there delays? Are there, complaints? We do look at that information just to see how we're doing there. But when it comes to the counties that are not through the vendor, it's very difficult for us to see how things are going.
Well, we have about 3 minutes and 3 panelists. Can you guys do it?
I'll be quick.
All right.
Our agency, what we deal with is not transportation specific. I would say the biggest thing we are measured or looked at is audits. We get our programs audited and we'll get cited if we're not following policy. So that's a big thing that drives what we do. It drives new policy, it drives process. And we also do outreach customers, like satisfaction surveys, at least for the Independent Living Services program, to see how satisfied clients are with the services that they receive. And they actually always come back with really, really high marks. And I think because that program is it's in-home services provided to them. There's case management with in-home home visits. It's very personable, one-on-one, and people, in at least the disabled and senior citizen kind of populations do enjoy that hands-on, one-on-one personal contact. So that's been successful.
At the federal level, the VA does track how many appointments are missed because of transportation being a challenge, both at the hospital level and at the CBOC level. I would say at the state level, because we're more of an aggregator than we are a service provider, we could look at how many people don't make their Michigan Works appointments and other types of things and fall out of the system and fail to be able to sustain their employment because of transportation challenges. And third, from an operational level, with our call center, we're able to, again, provide the solutions and the resources that are available. We are not currently able to track how many people fail to connect with those resources because of their transportation disconnect. So that would be something that we would be looking to look at and look at our program as well.
And I'm going to keep this short and sweet. I work with the Department of Civil Rights. And often we get complaints filed from people who experience discrimination or lack of access to services. And so that is how we keep track of how our customer service is performing, and it's related to transportation as well. Another thing I think that is equally as important is that more and more state agencies and community organizations are using our office as a resource, because we are the only state agency focusing on the deaf, blind, and hard of hearing. And so I think that the more that the general public and providers and transportation agencies fully understand the benefits that we can provide to people with disabilities, senior citizens, the veteran population, that they'll reap the benefits of that if they remember to access our services.
Well, ladies, I'm about ready for a sandwich and a Coca-Cola. I don't know about you. Thank you very much. That was awesome. Let's give them a big round of applause.